Hey everyone. I pay a great deal of attention to posture, body alignment, and the spine in general. I myself have experienced injuries and developed scoliosis, which naturally led to severe pain. And that's what pushed me to study this topic in depth, to work on myself, and obviously on my body. That's why I'm happy to share my experience with you. So now I'm going to walk you through a simple but effective routine that has helped me and many of my clients. These exercises will also be very beneficial for those who don't have a pronounced kyphosis, because improving flexibility and strengthening the back never hurt anyone. And that feeling of lightness in the body, it's an indescribably pleasant sensation. Alright, let's get started. First, a little theory. Let's talk about the spine. When viewed from the side, the spine has a series of normal curves, the lordosis of the lumbar and cervical regions, and the kyphosis of the thoracic and sacral regions. We talked about this in the previous video on hyperlordosis. I highly recommend watching it if you haven't. We'll leave the links so you can go check it out. This shape of the spine allows us to absorb impact loads, for example when running, jumping, or just going about daily life. But with incorrect body positioning, for a number of reasons, these natural curves become unnatural, and in medical terminology they're referred to with the prefix, hyper. The most common one is hyperkyphosis of the thoracic spine. Pathological kyphosis, or hyperkyphosis, is usually just called kyphosis in medical terminology. So in this discussion, we'll use the term kyphosis to mean hyper. In other words, kyphosis is a deformity of the spine in the upper back that causes an exaggerated outward curve. Simply put, it's when you look at someone and say, "Hey you, why are you walking around all hunched over?" It's easy to spot from the side. Shoulders rolled inward, chest sunken, back rounded, head pushed forward, gaze naturally dropped downward. Normal spinal curves allow the head to balance directly over the pelvis. But with kyphosis, the center of gravity shifts and weight distribution changes. This leads to constant pain in the neck, thoracic region, and even in the lumbar spine. Blood flow to the brain is naturally impaired due to muscle spasms in that area, which in turn causes headaches, dizziness, vision problems, and a range of other issues stemming from a lack of oxygen and nutrients. Most forms of kyphosis don't require any treatment. But kyphosis can progress, causing a worsening hump. In some cases, this can lead to spinal cord compression with neurological symptoms, including weakness, loss of sensation in the limbs, numbness in the fingers, or even complete loss of control over the bladder and bowel. God forbid, of course. Severe thoracic kyphosis can also restrict the volume of the chest cavity and cause problems with the heart and lungs, leading to chest pain or shortness of breath, and potentially to pulmonary or cardiac failure down the line. I hope by now I've frightened you all about the consequences of poor body alignment. If so, now is exactly the right time to pay attention to this. To start correcting it with exercises, while it can still be fixed without medical intervention. If you notice poor posture in yourself, your child, or someone you know, that's a direct signal to start taking care of the back. Correcting kyphosis works in two directions. Stretching the short, tight muscles to make them longer and more elastic. And on the flip side, strengthening and training the weak muscles of the back and rear deltoid. Now let's move from theory to practice, that is, to the exercises. Generally, you should always begin with a light warm-up. Simply rotate your shoulders 10 times in each direction, that is, 10 forward and 10 backward, with your thumbs placed on your shoulders. Then do lateral bends, 5 repetitions per side, with an arm reach, taking your time. After that, perform circular movements with your torso, Hands clasped in front of your chest. 5 rotations to the right and 5 to the left. All movements should be smooth and controlled. This will warm up the back muscles and make them more elastic for stretching, warm up the shoulders, and reduce the risk of injury. Spending just a few minutes on the warm-up significantly improves the quality of the stretch. So, as we've already said, we need to increase the flexibility of the muscles that roll the shoulders forward and prevent the back from relaxing. Even if you actively try to pull your shoulders back, you won't be able to sustain it for long. First of all, as soon as you stop thinking about your back, and you will stop thinking about it, the shoulders will fall forward on their own and return to their habitual position, which is a rounded back. And secondly, the back muscles will be in a constant state of overexertion, which will in turn show up as pain and the formation of so-called trigger points. The strongest and largest muscle that pulls and rolls the shoulder forward is the pectoralis major and pectoralis minor. I personally dealt with this problem, as these muscle groups are well developed in me. And when someone finally said to me, "Why are you slouching?" Even though I was generally trying to keep my back straight, I realized it was time to fix it. We also need to stretch the intercostal and serratus muscles, which, first of all, prevent the chest from expanding normally, and this reduces the intake of oxygen into the body by decreasing the volume of breathing. And secondly, they prevent the back muscles from relaxing. The coracobrachialis muscle, which rotates and tucks the arm inward, also falls into this category. So, let's go over the first and simplest exercise, which you should do as often as possible, even without warming up. It's a chest opener using a wall as support. Stand near a wall at a short distance. Place your forearm against the wall. Hands one on top of the other, push the hips back, and reach forward with the chest, directing your gaze upward. The goal is to bring the chest closer to the wall while keeping the arms nearly straight. All exercises are done with deep, steady breathing. As you relax, gradually slide both your arms and chest downward. You can touch the wall with your chin, but be sure to keep your gaze directed upward. Keep the legs straight and pull the hips back as the chest moves forward. Do a full 15 to 30 breaths. That is, a deep inhale and a long exhale. Then lower your arms and rest for about 30 seconds. The second exercise is done from the same position, but this time step a little farther from the wall, so that you can press into it with straight arms. Place your hands just above hip height, shoulder width apart. Direct your gaze downward, and arch through the thoracic spine, pulling the hips back. If you lack flexibility in the legs, just bend the knees slightly. Remember, reach the chest downward, push into the wall with straight arms, and most importantly, breathe deeply and steadily. Do 15 to 30 breaths. If you prefer, you can simply set a timer and hold for 1 minute. Now, the third exercise, shoulder rotations with a yoga strap or belt. You can also do this with a towel, a resistance band, or really any rope of a suitable length. I often just use a regular pants belt. This exercise does require a warm-up and shoulder preparation, because with too much force you can easily injure yourself. So please be careful and perform the movement without excessive effort or pain. Stand up straight, feet shoulder width apart. To begin, grip the strap as wide as possible with straight arms, smoothly and with control raise the arms overhead. And without forcing it, rotate the shoulders and lower the arms behind the back. Then bring the arms back to the starting position just as gently. Again, performed without excessive force or pain, and the shoulders must rotate simultaneously. Don't do it one at a time. If you can't do it, use a longer strap to make it easier. Trust me, as your mobility increases, your grip will gradually get narrower and narrower, until you're eventually holding at shoulder width. Perform 10 to 20 smooth rotations. And the fourth exercise in this sequence is the hands clasped behind the back. Why is this exercise so important? First, it increases shoulder joint flexibility, which is very important, especially if you train in the gym, because even a minor shoulder injury can set you back for many weeks, sometimes months. I know from personal experience, having injured my shoulder at a CrossFit competition. Second, it stretches the coracobrachialis muscle, which strongly rolls the shoulder inward, increasing kyphosis. Stand up straight, bring one arm behind your back and try to place it as high as possible between the shoulder blades. You can help it with the other hand. Then raise the opposite arm overhead and bring it behind your head to form a clasp. If you can't reach, you can use a wall for assistance, but please be careful as it's easy to injure yourself. If you can't reach, it's actually better to use a towel, a resistance band, or a belt, gripping it with both hands. Trust me, with time you'll be able to clasp your hands easily. Once you've made the clasp, try to straighten up and hold that position for 30 seconds, then switch sides. I do 2 to 3 switches per side. Then rotate your shoulders to relax them. These exercises should, at minimum during the first stage, be done at least twice a day, morning and evening. And ideally, whenever you have 5 free minutes. But don't overdo it in the early stages either. I do these exercises at my desk after every few hours of work. If I've been sitting for 2 to 3 hours, I get up, do all 4 exercises. It takes 5 minutes maximum. And sit back down feeling refreshed. If you're not sure how to stand up straight, do this exercise. Walk up to a wall. Stand upright. Press your head back. Bring your heels as close to the wall as possible. Press your tailbone against it, but without creating a strong arch in the lower back. Reach upward through the crown of your head. Touch the wall with the back of your head, and hold this lengthened position for 30 to 60 seconds, about 1 minute. The fifth and final exercise, I consider it a sort of relaxation, but it beautifully opens up the thoracic spine without any strain. For this we'll need a foam roller or any rolled up blanket. When I'm away from home, I often just use a 2-liter water bottle, or a rolled up mat. Place the roller under your shoulder blades, lean your back onto it, bring your palms behind your head, and lean back, opening up the chest. The hips must stay on the floor, while the legs can either lie straight or be bent at the knees. This is more of a breathing exercise, so breathe fully and deeply and relax. Lie in this position for 1 to 3 minutes. This exercise is wonderfully relaxing. You can do it right before bed, or simply whenever you want to unwind. If you're outdoors, any bench works perfectly for this. Lean your back against it where the shoulder blades end, bring your hands behind your head, and lean back. Pull the hips in the same direction and hold there for at least about a minute. Personally, I would supplement this stretching routine with one of my favorite yoga poses, the bridge. But you should approach it carefully and gradually, as it's possible to come up by overarching the lower back rather than by opening the thoracic spine. And that can actually lead to tightness. I know there have been cases like that. But overall, done gradually and carefully, it's worth mastering for kyphosis. I only do it after all of the above exercises, right at the very end, when I'm already thoroughly warmed up. So, lie on your back, place your feet close to your glutes at hip width apart, and your hands close to your head, also shoulder width apart. At first, place your hands a bit farther out, and as your flexibility increases, bring them closer. Lift up using the strength of your back, legs, and arms, arching through the thoracic spine. To take pressure off the lower back, shift more of your body weight onto your arms and engage your glutes. And one more tip, rise up onto your toes. It will definitely ease the load on the lower back. I hold this position, doing 15 deep breaths, then lower myself, bring my hands a little closer, and lift up again for another 15 breaths. I do this about 3 times. Then I lie down, rest, and relax my back. Make sure to bring your knees up to your chest to fully release the lower back. It's also great to rock on them, back and forth, like a mini self-massage. That's the complete routine for increasing flexibility in tight muscles. You may not need to do the bridge right away. Just stay with the chest opener, where we lie back over the roller. Trust me, even after the very first time you go through this stretching sequence, you'll feel such lightness that I hope you'll make it a regular habit. As I said, twice a day. Morning and evening is ideal, it doesn't take that much time. At least for the first few weeks. After that you can drop it to once a day, for example as a replacement for your morning workout or as a complement to it. By the way, you can find my morning workout routine on my channel. I'll also leave the links in the description. But remember, as we increase flexibility, we also need to strengthen the weak back muscles. The stronger the back muscles, the less effort they need to maintain balance in the correct position. The first exercise is done standing or sitting with a resistance band, which you can order online or buy at a pharmacy. So, take the band, raise your arms to eye level, and make sure your shoulders are dropped down as low as possible. From this position, pull the band apart to the sides, drawing the arms back. The elbows can be very slightly bent, but ideally keep the arms straight. At the end point, when the arms are spread wide, squeeze the shoulder blades together and hold. Shoulders stay down, that is, check that your shoulders are not rising up. To help with this, also engage your core so you don't arch in the lower back. Then return to the starting position, arms at eye level, and perform 10 to 20 repetitions. Rest for about 30 seconds and do another set. The key thing when doing this, as I said, is not to raise the shoulders toward the ears, because that will heavily engage the trapezius and the neck will get really tight. Just pull the shoulder blades down. This exercise is excellent for strengthening the rear deltoid and the muscles that draw the shoulder blades together. By the way, for those who have winged scapulae, where the shoulder blades seem to stick out of the back, this is a great exercise. Now, the second exercise, back extension, done lying face down. Lie on your stomach, legs hip-width apart, toes on the floor, hands placed behind the head. From this position, perform smooth lifts, trying to raise the thoracic spine, that is, lift as high as you can. If this is too difficult with hands behind the head, you can place your hands at temple level and do the same movement. Each lift is done on the exhale. Smoothly but with force on the way up. And smoothly back down, without the hands touching the floor. Do about 15 repetitions. After finishing, extend your arms along your body and rest for about 20 to 30 seconds. I personally rest for almost just 10 seconds and immediately move on to the next exercise. So, the second variation, extend the arms forward, and on the way up perform what resembles a pulling motion. Reach the arms forward, then pull the elbows back and squeeze the shoulder blades. When reaching forward, the arms don't touch the floor. Make sure your neck is in line with your body, gaze directed downward, don't throw the head back. Do the same thing calmly, 15 repetitions. Rest for 10 to 30 seconds. And the final, third variation immediately after. Extend the arms out to the sides, and on the way up together with the torso, squeeze the shoulder blades, trying to lift as high as possible, but with no jerking. Breathe steadily, without holding your breath, and again perform about 15 repetitions. After the entire sequence, be sure to push the hips back, arms along the body, and just fully relax, lie there for up to 1 minute. Then repeat the whole thing once more. In the beginning, you can do just one set. So for the first week, do it twice a day with only one set. Then for example move up to 3 times, and the following week do 2 or 3 sets. The most important thing after these exercises is not around the back. I know a lot of people love to curl up and stretch out the back muscles that way. Actually, it's much better to stretch the opposite way. That is, do what's called a cobra, or upward-facing dog from yoga. After all, we're strengthening the back muscles. They're already overworked as it is, so why stretch them even more? On the contrary, strengthen them, make them strong like cables. For the first week, as I said, it's best to do this right after stretching, once or twice a day. After that you can move to 3 to 4 times a week, and for maintenance, 2 to 3 times a month. Though that's honestly not enough. You should aim for at least twice a week for these strength exercises. You can simply incorporate them into your regular strength training session. One more thing, for kyphosis, I would definitely recommend adding pull-ups on a bar using both overhand and underhand grip, at shoulder width. This will not only strengthen your back, but also improve your overall proportions and give the back a great shape. If you don't yet have the strength to do pull-ups, you can use a resistance loop band. It looks like a loop, and you can easily find it online or at a sports store. The price is very affordable. Which one exactly to choose? I can't tell you. It depends on your own body weight and strength. I go with something in the middle between strong and light resistance. By the way, it's also great for shoulder rotations with straight arms, for when we stretch the shoulders, as well as for back strengthening when doing the rear delt pull apart. And it's fantastic for working up to muscle ups. I practice muscle ups with it first, then move on to doing them without it. It's a real shame this isn't a sponsored segment. The manufacturers haven't reached out for a collaboration. So, my friends, if you have the opportunity, please start swimming. Swimming is an excellent full-body workout that lengthens the spine, strengthens the back muscles, and increases flexibility in the shoulder joints, especially when swimming freestyle. Even a couple of times a week, or at least once a week, would be a great complement to this routine. I usually swim 2 to 3 times a week, sometimes even 5 times if my schedule allows, for about 30 to 45 minutes at an easy pace doing breaststroke. It's basically my cardio. And one more unofficial rule, whenever you walk past a pull-up bar, hang from it. Of course, ideally you do some pull-ups, but in our case, just hanging is perfectly fine. I genuinely don't understand why, as we grow up, we completely stop hanging. As kids it was nearly impossible to get us off the bars. I remember hanging endlessly. So hang more often. It's a great way to decompress the spine. The one thing I'll say is, if you have a herniated disc in an acute, aggravated state, I'd probably hold off on hanging. But in all other cases, it's absolutely fantastic, and as a bonus it builds forearm strength for pull-ups, various other exercises, and even just carrying bags. Everything I show you and recommend, I do myself. I don't just pull it from the internet without checking it. This routine genuinely helps me maintain thoracic flexibility, even with strength training and fairly heavy workloads. I encourage you to do this routine at least once. Try how you feel afterward, and if you like it, you'll keep coming back to it. And as for me, my swimming session is just about to start, so I'm off. Thank you all for watching. Until the next useful video. See you.